Today we're going to be injecting some Botox in Kelly here. As I mentioned, most of my patients, Botox is probably the best first thing for anybody to try who's never had any kind of surgical or non-surgical facial procedures before. Kelly's a great example of this. She's a beautiful woman and she's still very young, but Botox is the best first thing to do. She's just getting early wrinkles and lines, the 11 lines between the eyes and a little bit around the corners of the eyes. So I'll show you today how we're going to inject a very basic amount of Botox in a real straightforward procedure for a patient like Kelly. So first thing we're going to do is just clean the area here. I'm wiping off a little bit of her makeup. I tell my patients they can put makeup on immediately after we're done with this procedure. And the next thing I like to do is mark the muscle, and I can see it if I ask her to do a couple things. So go ahead and frown for me as best you can and hold that. Very good. And I'm just marking where I see the muscle movement. Okay, now smile for me. Same thing over here. And I think this is the best way to really know exactly where you need to be injecting this. Same thing, smile. And then I'll have her put her head back, just relax. She doesn't have to do anything special. And let's go ahead and inject a little bit at each dot that I've made. Okay, and then for the corners of the eyes, I do the same thing. I'll have her turn her head away from me just a little bit. Little pokes over here as well. These I just put just barely under the skin. And for her, I'm just doing about half as much as I normally would in this area. That's all that she needs. After this, I tell the patients that they won't expect to see any changes or any of the effects of the Botox for about a week. So they need to just keep an eye on it. And then for anybody that I inject the first time, I like to have them come back in 2 weeks just to make sure that it's doing what I want and it's doing what she wants. And that's it.